Hey everybody, so someone had a good request to ask about how to display empathy and just have empathy for other people in a medical setting, and I think that's a great question. I think it's very hard to do because even if you do feel the pain for someone that you hear they're going through a difficult experience, it's sometimes very hard to kind of display that appropriately. I'll just say it's very hard to do, and sometimes you won't do it right, and that's just part of how it goes because people are different. People want different responses. There are some people who respond very well to you just giving them a hug, and other people would not like it. Me personally, I'm not a very touchy-feely person, so like that would not work for me, whereas I have friends where just a simple touch, putting your hand on their shoulder would mean so much to them. So this is just a hit or miss kind of thing, and you just have to try and read the person. But just knowing that you care about that person is the first step, and just acknowledging that, there is a way to approach patients. So the number one thing I recommend is make sure you make the time to talk to that person. So I was recently on a surgical oncology rotation. There's a lot of people that are going through very difficult things, and I had clinic patients that I would talk to. I had patients in an inpatient setting that I was speaking to who are going through very difficult things. There are some times where you had to display that empathy. Sometimes you can't do it every day if they're inpatient because you have to try and create this kind of normalcy for them, or at least that's what we would try to do for some of the patients. But there were these moments where they were finding out for the first time something horrible that was happening to them, and you have to make sure you do that when you have the right time to talk to the patient. So don't tell them that they have pancreatic cancer and know that you have to leave in like 5 minutes. I know in one situation we had a patient who found out that they had metastatic disease, and you could have told them right after they got out of the operation, or you could wait a little bit and just make sure that they were, coherent and out of the anesthesia grogginess when you had ample time to talk to them. So make sure you have the time. I definitely have times where I have my pager going off. I just look at it, tell the patient, hey, I have to look at these pages, but if it's not anything emergent, like I just have to look and then put it back and I'll address it when we're done talking. Make sure to keep eye contact with the patient. That's kind of along the same lines. Don't be checking your phone constantly. I think sometimes we are very accustomed to looking at our phones and our pagers because there's so much pertinent information being told to us that we have to kind of remember, to other people, they don't realize what we're seeing on our phone. They just see you being distracted on it. So try and avoid having to look, but just tell them, sometimes you just have to let the patient know, like, I'm not trying to text someone randomly. It's because I have to make sure the other patients are okay too. But if it's not emergent, I'm gonna look at you, I'm gonna talk to you. Other thing too is let the patient talk. Sometimes it's so easy, I'm rambling right now, but if someone was talking to me and had an issue, let them just talk. Sometimes they have to take a pause, let them take the pause. Don't, immediately interject, but just let them go. Let them talk about what's upsetting them. Sometimes they just have to let everything out, and you just let them. Sometimes people just want someone to talk to, and you can just do that. And that's honestly a great way to show empathy, just to know that people want to be heard sometimes. You're going through a horrible experience, and sometimes you just want someone to listen. So make sure to give the patient the time to talk and in that moment, and also make sure that you're not the one rambling on. Try and explain things to patients in the most basic terms that you can, not because they're incapable of knowing, but because, they don't have a medical degree, and they're all sometimes in shock and going through all these emotions. It's kind of easier if you just simple things down and just say the basics and kind of create analogies that are kind of, relevant for them. And I'm trying to think of one specific patient who I just remember I really did have to, she was not enjoying her time in the hospital, so I try and make the time to come see her and talk to her. You have to listen to their concerns too, because I know this patient, she just did not want to be in the hospital, and I knew that, but I told her, I want you to be safe, and I can't send you out just yet because it's not safe for you. And you just have to acknowledge, I totally understand. These are the reasons you want to go home, but I also explained to her my reasonings why I thought she should stay. I want you to get to your goals. I want you out of this hospital, but if I send you out too soon, you're going to come back, and that's definitely not the goal. So also explain your rationale and your reasoning to the patient, if you're doing something that they're not totally thrilled about, be like, it's in your best interest. It doesn't help me if the patient's stuck in the hospital. I have to, do all these extra things for them. Like, it does not help me. I want the patient to go home. I want them to be happy. I don't want them to be stuck in a hospital where they're going to have prolonged risk of infection or something. Like, I just want them to be happy. So sometimes you just have to let them know and remind them, like, I'm doing this for you. You just have to, because sometimes there's like this misconception that we're like out to get people and like we're not really thinking about them. But at the end of the day, they always say the patient is your priority. And sometimes you just have to remind them, like, yes, you are my priority. I have like a bunch of different priorities going on. And sometimes I'm not always able to give you the attention you deserve, but you are my priority too. So those are my tips for how to kind of displaying that empathy to people. It's really just, display some emotion too. Sometimes I'm like overly emotional, and I also have to work on that. Like, people will tell me these really sad stories and I start tearing up, and it's like, dude, like, you can't tear up too much with these patients. Like, show that you actually are responding to their stories and that you actually like do feel something and you're not just some sort of robot. But it's also okay. Honestly, I feel like it's okay if you don't have to always feel like you're about to cry every time someone tells you something, but just let them see that you are, listening to their story, that you kind of react appropriately. Don't completely sob, but also don't like roll your eyes and just like not be paying attention. Just make sure that you're like listening to the patient. For me, I think that's the biggest thing, is just making sure they feel heard. If I learn any more tips and tricks, I'll let you guys know, but I really think just remember you're talking to a human who's going through a really hard experience. If you remember that and keep that in mind, I think you really can't go wrong. And if you do, it's because people are also different and like different things. So I hope that this video is helpful. If you guys have any questions, comments, concerns, please let me know. Thank you.